Okay, we're going to do some trach care on Mrs. Smith here. Before going to the patient's room, I would go ahead and collect all my supplies. I need a sterile suctioning kit, canister, also the trach care kit, a resuscitation bag, some sterile saline syringes, a trach mask to oxygenate my patient, and then also some PPE that might not be in the room, like a face mask. So I'm going to go ahead and start. Enter the room. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory department here at the hospital. We're going to go ahead and do your trach care for the day, okay? This should be done at least twice a day, and I'll communicate with your nurse that it was done today and document it for you. How's your trach feeling? Is there any irritation or anything bothering you? No? Okay. Well, I'm going to go ahead and wash up and get started. So I'll wash up, put on some gloves. I'm going to listen to my patient's breath sounds. I'm going to check my patient's cuff pressure. It should be in between 20 and 30 centimeters of H2O. And then we're going to go ahead and set up the suction canister, and we'll start the sterile portion of the trach care. So I'll go ahead and open up the trach or the sterile suctioning kit, and I'll oxygenate my patient here. We'll get the gloves. I'm going to put my left hand in first. That'll be my clean hand. My right hand will be my sterile hand. And then go ahead and put them into the canister here. And with my sterile hand, I'm going to secure the catheter tubing, and then with my clean hand, I'll hook it up to the suction wall, put some lubricant in my hand, in my sterile hand, and we'll go ahead and suction patient. All right, Mrs. Smith, we're going to insert. Felt a little resistance. I know I hit the carina, so I'm going to back up a little bit, occlude the thumb port, and suction my patient. Shouldn't take longer than 15 seconds. Okay. Now I can go ahead and start cleaning my patient's trach. I'll just hyperoxygenate her. We'll leave, put this down. I'm going to go ahead and untie the trach here, trach collar. I could take out this gauze, dispose of it, and we'll take out the inner cannula. The inner cannula is either disposable or non-disposable. If it is non-disposable, you can clean it in our trach care kit. There's some little pipettes here and a basin filled with saline. Clean it out and set it on gauze, let it air dry. Now in the other basin that we have here, I'm going to insert some, or I'm going to put in some sterile saline, and I'm going to go ahead and clean the stoma site. With each Q-tip, I'm going to start from the inner portion and work my way out, disposing each time of it, getting a new Q-tip each time, cleaning around. I'm going to be inspecting the stoma site as well for any excessive drainage, any tenderness, pinkness, anything abnormal, foul smell, any sign of infection. Now I can go ahead and make sure I did all the way around the stoma here. So now we can go ahead and put a new gauze or foam pad underneath the flange here of the trach. I'm going to tie a new trach collar around there, and make sure that we have a new inner cannula inserted. We want to make sure that we always have extra inner cannula. If they have a non-disposable inner cannula, we definitely want one of a smaller size to make sure, and just in case there's any inflammation and swelling, it's easily inserted. And now I'm going to just make sure that reassess my patient, check their cuff pressure in between 20 and 30, go ahead and listen to her breath sounds, check her SpO2, make sure she's in a comfortable position, and clean up my stuff here, make sure my patient has her call light, she's comfortable, document, and let the nurse know